and welcome to Kaleidoscope, brought to you by India Head. We're again here today for a very important discussion. In the past 10 days, which have been particularly hard for our country, there has been a lot of panic, and certainly, the kind of news reports that we're getting are not always encouraging. And being at home and seeing people that we know suffer is a time of anxiety for everybody. I don't think there's anybody who's not touched by what's happening in our country right now. From that, of course, comes a natural desire to be of help, to do something useful. And a lot of us have been amplifying requests. In fact, I think all of us have been amplifying requests on social media and, trying to connect things wherever we can. And in that, I think we've all been united by good intention and absolute a desire to be of some service, of some help at this very, very difficult time for our country. However, what has also been happening, as usually does happen, unfortunately, is that politics has not been far behind. There have been vested interests that have highlighted certain things to create issues. I remember starting with our indigenous vaccine, Covaxin, which today, incidentally, Dr. Fauci, who is renowned as a world-renowned epidemiologist, has said that it's very, very good and very effective. But if you recall, there were these instances where politicians were saying this is a BJP vaccine, whatever that means. Don't take it. It hasn't been tested. And this was being done by, mainstream politicians, people who've been former chief ministers, and all kinds of people who have a certain mass appeal and credibility. Definitely limited, but they still have it. And one has to really ask that question today when Dr. Fauci said that this is a good vaccine, it's effective, whether those kind of warnings, which were entirely politically motivated, impacted the vaccine dosages and the fact that people were hesitant, or what we call vaccine hesitancy. And that's a very serious question. And my question to those politicians is, was it worth it? What we're braving today, what we're facing today, the fact that you created such fear around this indigenous vaccine that was made in India, was it worth it? Finally, the Prime Minister took that same vaccine himself, and that encouraged a lot of people to go ahead and take their vaccine shots. But we have lost time, and we may have lost lives also because of these kind of politics and rumor mongering. Secondly, another thing that came to light today was the story that was published in The Wire, which was about a youth from Amethi. This is, as you know, Smriti Irani's constituency, I beg your pardon. And, she has, of course, had a real triumphant win in 2019, which was shocking to most people, and who couldn't quite understand how somebody could trump a person like Rahul Gandhi, whose family, as you know, has treated Amethi as its personal bastion. Subsequently, last evening, it was 2 nights ago, if I'm not mistaken, in the middle of the night, around 12:30, there was a request for oxygen that was highlighted by a journalist who works for The Wire. And when Mrs. Irani has actually been very active on social media, I've had that experience myself. She's responding very quickly at all times of the night and day. In fact, The Wire article did admit to the fact that she was responding despite the lateness of the hour. And it was eventually found out that this person was asleep when the administration finally reached him. And it wasn't, and the gentleman had already passed away before this tweet. And it wasn't even a COVID-related issue. It was a natural passing. And today again, then the police lodged an FIR. They did a press con, and we really have to ask what motivates these kind of rumors and lies at this time when everybody is just stretched emotionally, financially, in terms of facilities. It's a really difficult time, and this is really the context in which I wanted to set this debate and start with, of course, Abhijit Iyer Mitra, and get his views and then go across to all our three guests. I'm very happy that Abhijit's with us, Raghav Awasthi, who is a lawyer with us, and of course, Richa Anirudh, who is a very famous journalist, RJ, has a lovely show, positive show on TV and then on YouTube as well. And I really thought that, someone who's is from the news world, but it focuses on positivity and truth telling, it would be lovely to have her with us as well. So she's not very well, so unfortunately her video's off, but I'm still very grateful to her for joining us. So welcome all of you, and let's start with you, Abhijit.
Thank you, Advaita. So, historically, if you look at it, a crisis society, either going through a traumatic war or going through a pandemic like this, is an environment that is absolutely rife for rumors, fear mongering, and other kinds of activity. Now, there's you know specific economic activities, like, for example, price gouging, extortion, and hoarding that happens during periods like this. I think saw that today, where there was a tweet of somebody who had put out this bill for the ambulance, and the ambulance charged this guy 10,000 rupees to take his mother just 3 kilometers from Pitampura to the hospital that was slightly over 3 kilometers away. 10,000 rupees, right? So this is sort of very classic. But then what you have in such societies is that very frequently, in order to gain attention, especially, and this is a Twitter phenomenon where people talk about how facts are racist and lived experiences are what you must deal with. People sort of pile onto, they're sort of story magpies. They take other people's stories or anything to gain salience that will get them noticed, that will get their 10 to 15 seconds of fame and things like that. We saw that with TV, when TV and bloopers came out. You remember, everybody would try to do something, pull off a stunt or something so that they could feature on TV, that 15 seconds of fame phenomenon. And you see that today on Twitter, that you're going to be quoted by XYZ, so on and so forth. This is going to happen. So this is one side. The other side is, and this is kind of socially understandable, because this we've known for the last 2,000-3,000 years has been anthropological history, that this is how some people tend to behave, and there's no curing it, I guess, except through deterrence of punishment. Now, there's another kind of behavior, which is what we've seen our politicians do in terms of vaccination hesitancy. And that is much, much more dangerous, because these are people who should really know better, and shouldn't really be saying the kind of things that they've been saying. The problem is that, their hatred of Modi, combined with their impotence at removing him, has turned into something particularly venomous, full of bile, and absolutely toxic, to the point that they've come to hate India. They've come to hate everybody and anything that can make an Indian cheerful or happier or proud. And it's just become such a toxic cycle that these people are just wallowing in their own sea of cobra venom.
Yes, and I think the thing that the vaccine hesitancy was something that was really, really important at this critical time, because, when this second wave has come, it's been virulent, it's been very difficult, and we're passing through the midst of it. Raghav is, of course, in Germany right now. And, I'm curious, Raghav, I know the news out of India is really morbid. You were here during the first lockdown and spent the entire time here. And you've always had this positive attitude about COVID and the fact that we must triumph and we must, get ahead and get back to life and normal. But what is the? I would just like to start with what you're hearing in Europe, and as well about this rumor mongering and things like that is going on.
So there are two things that we have to consider. First, of course, is that I would like to correct you. I was not here during the course of the whole lockdown. I came here last August and stayed here till November.
Okay.
And that's during the lockdown, although Germany was open between August to October. And the second thing that we need to have is some perspective. And it's very difficult to impart a sense of perspective to anybody who has lost their loved ones. And therefore, I'm not addressing myself to them. I'm addressing myself to the vast majority of the people. And the fact about this disease is that about more than 90% of those who get afflicted by it, that's the cases, not the total infection. The total infections are likely to be much higher. They are going to get cured. That's what the first. The second thing about the point that you made about the second wave is that yes, it is there and it's particularly virulent in India, but it has been virulent everywhere. To put things into perspective, in the United States, we saw a peak of 4,400 or 4,500 deaths in January. In the UK, which is about 5% of our population, we had 1,000 daily deaths in January again. And there was this talk about a new virus variant that was sweeping the UK. These countries managed to beat the virus, and there is absolutely no reason why we would also not be able to beat the virus. But now we come to the most important part. If we want to prevent the recurrence of these waves in the future, we need to have an effective program of vaccination. And the truth is that there were many vaccine doses that were getting wasted because so many people who were 45 plus were not coming forward to get themselves vaccinated, and that is a huge that is a huge problem for and because of all of these reasons, we have a situation where not all the vulnerable sections or segments of our population are vaccinated till now. So, and I think this is right out of the playbook of the left countries like the United States and elsewhere, because the idea is to somehow discredit the prime minister. The prime minister, of course, cannot stand in line and take jabs for you in his arms. He can't do that. No politician can do that for you. So ultimately, it's the people who need to show more responsibility. And I frankly do really feel that there is a sense of doom and desperation that we have around this disease, which is not really necessary, right? There are so many people who are getting cured. Just yesterday, there were 3,000 odd people who died, but there were more than 260,000 people who also got cured. So we need to also be talking about that. But I guess the fear mongering in the media is happening for a particular reason. The fear mongering is happening because the people who have till date proven to be so incompetent at replacing Narendra Modi think that they have managed to get him into a corner. And of course, the vaccine hesitancy is also their doing. And so they feel that they have him right where they wanted. And this might be good politics from their perspective, but it's really, really bad for the country as a whole, because unless each and every one of us, or at least more than 70% of us, that's the threshold that has been fixed, which sounds a bit arbitrary, have been inoculated, then the rest of us are not safe. So we need to make sure that we get those jabs in our arms as soon as possible. I would still maintain, I stayed in Europe for 3 months last year, and I'm in Germany right now. Our outbreak, for the most part, except for the bigger cities like Delhi, is not as bad. And even cities like Mumbai that had 11,000 cases every day are now down to around 4,000 or so every day. So if there is one thing that we know about the second wave, is that the percentage of people who develop serious symptoms is actually much less. So the second wave is about volume, right? And this is something that we can glean from statistics. So I think we should not yield to this atmosphere of gloom and doom. And the second thing which I would really like to strongly emphasize is that the lockdowns are definitely not the solution. And there is enough empirical evidence from around the world that lockdowns do not have any perceptible effect on the trajectory of the pandemic, except, of course, if you're a country like Australia or New Zealand, which are really sparsely populated countries somewhere in the Pacific Ocean. What would work for a country like India is a mass vaccination program, and I really do believe that politicians across party lines should be encouraging people to get vaccinated. This wave is going to my mind, and this is something that Shamika Ravi has also pointed out, it is slowing down and it might subside by the end of next month, tops. But we need to simultaneously make sure that the vaccination program also continue that.
Yeah, I mean, yes, there was this negativity, and we didn't see them, opposition leaders and all really coming out and showing themselves getting vaccinated and, building that kind of confidence also. I mean, the prime minister did do it very quickly. And there was, of course, that reason that because there was this whole campaign that was going on about, this vaccine not being something to trust, et cetera, that people were very, very hesitant. And, Abhijit has, of course, mentioned this, and I do want to discuss this at a later point, and I think we should, about the soft regime change and the kind of politics of it, which are ongoing. I don't think we can separate the politics, unfortunately, from what is happening right now. And we must discuss that at length because some things have been very worrisome. But rather than the Western media, I would like to quote our friends from Mongolia, who very sweetly held up a big heart outside a plane. I guess they were receiving their vaccines right now, just a few days ago or something. And they held up the sign that said, "Don't give up India." And that really moved me because like you said, Raghav, there's so much doom and gloom and all kinds of predictions and the kind of imagery that they're putting out there. It can really compromise one's confidence. And the one thing that we need as a country at this point is to feel confident. Yeah, hi. I know your video's off because you're not feeling well, but thank you so much for joining us today. And I know you're aware of this Amethi issue.
Yeah.
I wanted to understand from you, since you are the professional journalist amongst us today, how does this work? I mean, in a time of a crisis like this, like a pandemic, what are the basic journalistic rules that people should follow when they're on social media, like the journalist from Wire who tweeted this request without verifying it and really sent the entire admin into a tizzy? So just to get your thoughts on this to start with.
Yeah, so Advaita, more than a journalist, I've been, me and my team last 3-4 days, if you've noticed, what we noticed was कि हो क्या रहा है, बहुत सारे ना WhatsApp, people are just forwarding information. Oxygen is available here, 100 beds are available, and you realize that none of the numbers work. So I thought, people, जिनका कोई अपना उस समय अस्पताल में है या they're looking for a bed, they don't have time to dial 20 numbers. So 4 or 5 days back, my assistant who works, everyone is working from home, from remote locations. I told them, let's do this service. Whatever message comes to us, let's start verifying. If we have a list of 20, someone said, Patna mein itne jagho pe ye numbers hain. So I said, even there are 50 numbers, please call up each number, find out which is switched off, which is not operational, this, and only share the number that's working. Okay? So that's one responsibility me and my team have taken up. Now, what I would really like to say is, people, if you're forwarding information without sharing, without verifying, that's really criminal right now, Advaita, because every minute is precious. एक चीज जरूर है अमेठी में, the way Smriti Irani ji, I have to say, the way she personally got involved in one tweet, a lot of people are not getting involved to that extent, because she said tried Shashank's number thrice. Probably she could have given up after trying once, but the way all of us who know her, she gets very involved, and probably मुझे लगा कि उसकी वजह से the whole administration, medical staff, so many people got involved, so much of precious time got wasted. Otherwise, probably after checking once, this case should have been left there, and उसके बाद भी मुझे लगता है giving it too much of importance, filing FIR, even that is not required. I'll tell you my personal experience. परसों की बात है, I think, someone from Azamgarh was tweeting कि मैं PGI के सामने खड़ा हूँ, बेड नहीं मिल रहा, one of my brothers has died, the other one is sick, this and that. So DIG Azamgarh, I know personally, I tagged him, and we kept asking this guy, भाई अपना number तो दो, भाई अपना number. The DIG saying, I'm trying, I want to call you, but where do I find? So probably after half an hour, 1 hour, DIG wrote this complaint seems fake because this guy is not responding. So one needs to give up after that. Amethi matter got dragged a bit too long. मुझे लगता है, Smriti ji tried her best to solve this matter. So even as the Wire journalist, I'm nothing against her. Probably she was trying to help, but थोड़ा सा verification. मैं आपको बताऊं, कई tweets ऐसे आ रहे हैं, मैं भी पहले एकदम retweet कर दे रही थी. Nowadays, I make it a point to read. Some people are saying, oxygen 93 urgent SOS. Oxygen 93 is not an SOS. You don't need oxygen urgently. You don't need an oxygen bed urgently. Please understand.
पैनिक शुरू हो गया है ना,
because तो हमारी जिम्मेदारी है कि हमें थोड़ा सा ये फिल्टर कर लेना चाहिए कि कहाँ पर किस प्रॉब्लम के लिए कितनी अर्जेंसी है, हम किस मैसेज को कहाँ तक, किस लेवल तक एस्केलेट करें, किस मैसेज को आप दिल्ली में तेजिंदर बग्गा, तहसीन पूनावाला, कपिल मिश्रा को टैग कर सकते हैं, किसमें आपको पीएमओ को टैग कर देने की जरूरत पड़ सकती है, या स्मृति ईरानी को, किसको, I have personally tried to be very careful, Advaita, on how much help is to be asked from which authority. वो थोड़ा सा अगर हम सब लोग, क्योंकि पैनिक तो फैला हुआ है, 95 ऑक्सीजन पे भी लोग पैनिक कर रहे हैं.
इसमें क्या अजीब हुआ था ना रिचा, कि द जेंटलमैन जिसके लिए वो मांग रहे थे ऑक्सीजन ना, कोविड,
उनको कोविड नहीं था एंड ही ऑलरेडी पास्ड अवे।
एग्जैक्टली, वो ही हैड ऑलरेडी पास्ड अवे, फिर उसके बाद ट्वीट हुआ
और
फिर
उनके नाना जी नहीं थे, उनके नाना जी नहीं थे वो।
और जब वो 10 मिनट बाद ट्वीट हुआ कि ही इज पास्ड अवे, तो ऐसा देख के ऐसा लग रहा था कि ये बात है, स्मृति ईरानी को टैग किया है, कुछ हुआ नहीं, ही लॉस्ट हिज लाइफ। तो वो माहौल बनाया जा रहा
वो
था।
माहौल बन सी अद्वैता, जब आप ब्लाइंड फोल्डेड,
ऐसी राजनीति है, और मैं कहती
ये
हूँ
राजनीति है। नहीं क्या होता है ना अद्वैता, अगर मेरे दिमाग में ऑलरेडी आपके लिए हेट्रेड है या मैं आपको नीचा दिखाने का मेरा उद्देश्य है, तो थोड़ा सा तो मेरा जजमेंट और सारा कुछ वो तो फिर खराब हो ही जाता है ना। आप थोड़ा सा न्यूट्रल होके, शांत दिमाग होके कुछ सोचेंगे, देन ऑब्वियसली यू विल बी एबल टू see things more fairly. But some people, you know, I feel pity for those people. अब तो मतलब पहले गुस्सा आता था, अब दया आ रही है कि उनको सिर्फ और सिर्फ इस समय भी ये लग रहा है कि कैसे बस गलती निकाल लो किसी तरह से, you know, बीजेपी की किसी, अरे गलतियां निकालने के लिए बहुत टाइम मिलेगा। राइट नाउ प्लीज डू योर रिस्पॉन्सिबिलिटी, यू नो। एज एक और चीज अद्वैता आई वांट टू मेंशन हियर, हम लोग फर्स्ट वेव की सेकंड वेव की बात कर रहे हैं। आई रिमेंबर गोइंग टू, देयर इज अ स्मॉल टाउन कॉल्ड दतिया इन मध्य प्रदेश, माय ग्रैंडमदर लिव्स देयर। लास्ट ईयर के लॉकडाउन के बाद आई डिसाइडेड टू गो एंड मीट हर, एंड मैंने ट्वीट किया था उस दिन। सो आई ड्रोव डाउन फ्रॉम नोएडा टू दतिया, ठीक है, बीच में ग्वालियर आता है, आगरा आता है, नो वन वाज वेयरिंग मास्क। आज हम पलटकर सरकार, हम सब पर जिम्मेदारी जिस पर डालना है डालिए, द इजीएस्ट थिंग टू डू इज टू ब्लेम अदर्स, but what were we as Indian citizens doing in this last 6-7 months? We need to introspect. We were attending weddings, we were celebrating all kinds of things, we were going in the markets, the malls were full. I remember my father is a doctor, visits a mall as a doctor. On 14th February he sent me a picture of a mall in Noida and it was crazy. He said this is Valentine's Day celebration in this mall in Noida. So हमारी क्या कोई जिम्मेदारी नहीं बनती? पिछले 6-8 महीने में हमने क्या किया? You know, some journalists yesterday tweeted, सबको पता था सेकेंड वेव आएगी तो सरकार ने क्या किया? हाँ, सरकार ने नहीं किया, please blame the government as much as you want, but अगर हमें भी तो पता था ना सेकेंड वेव आएगी, what were we doing as human beings, as citizens of this country?
कहना चाहता हूँ अद्वैता जी, just want to come in.
बिल्कुल बोलिए।
नहीं, मैं बस इतना कहना चाहता हूँ, बहुत अच्छी बात करी रिचा जी ने, और मैं उसमें एक चीज ऐड करना चाहता हूँ। हमारी जो सरकार है, जब तक अर्थव्यवस्था नहीं चलेगी, if the economy is not, there is nothing happening in the economy, the government cannot collect taxes also. So to say that we can or should just shut down the whole economy and everything that makes people spend money and pay taxes, and this is not how a country or any country can work, especially a country which is poor like India. India at the end of the day is still a desperately poor country even now. Therefore, there is a greater responsibility upon the people to engage in behavior that is COVID appropriate.
Yeah, exactly.
बिल्कुल सही बात ऐड कर रहा हूँ। जब तक कोविड अप्रोप्रिएट बिहेवियर जनता नहीं दिखाएगी, आप सब लोगों को ये बताओगे कि वैक्सीन मत लो, तो फिर उसके बाद अगर कोविड की सेकंड वेव आएगी, तो मैं तो एक चीज और कहता हूँ, कोविड की सेकंड वेव ऐसी चीज नहीं है जिसने किसी भी देश को छोड़ा है एक्सेप्ट ऑस्ट्रेलिया और न्यूजीलैंड। आप दुनिया के किसी कोने में चले जाइए, अमेरिका में सेकंड वेव आई है, कनाडा में सेकंड वेव आ रही है, ओंटारियो स्टेट में स्टे एट होम ऑर्डर है, मेक्सिको और ब्राजील की सेकंड वेव आज तक अभी तक फर्स्ट वेव ही नहीं खत्म हुई, सेकंड वेव की तो बात छोड़ दीजिए। पाकिस्तान में आज की तारीख में सेकंड वेव आ रही है, जो हमारा नेबर है। बांग्लादेश, श्रीलंका और यूरोप में तो इतनी जबरदस्त सेकंड वेव आई है कि 1 नवंबर को लॉकडाउन लगा था जर्मनी में, और अभी स्थिति ये है अप्रैल के मिडिल में उनको अपने रिस्ट्रिक्शंस टाइटन करने पड़ रहे हैं। तो ऐसा तो है नहीं कि केवल हमारे यहाँ ही हो रही है कोविड की तबाही।
वो तो बिल्कुल सही बात है, और एक ऐसा माहौल बनाया गया है यहाँ पे, और वो बिल्कुल मुझे लगता है बहुत राजनीतिक दृष्टिकोण से बनाया गया है, उसमें कोई दो राय नहीं है। इनफैक्ट मेरे जो परिचित हैं वो कनाडा में रहते हैं, जिनसे मेरा संपर्क रोज ही होता है हालांकि, और वो बता रहे थे मुझे कि वो बिल्कुल जैसे आपने कहा, वो लॉकडाउन पे चल रहे हैं, काफी समय हो गया, ओंटारियो में ही रहते हैं, और उनको एक वैक्सीन का टीका मिला है और दूसरा वाला उनको 4 महीने बाद मिलेगा।
इमेजिन।
और उनकी पॉपुलेशन देखिए, हमारी देखिए, तो रियलिटी
एक और मैं चीज ऐड करना चाहूंगा, केवल 2 बड़े मुल्क ऐसे हैं जिन्होंने अपना वैक्सीनेशन प्रोग्राम, यूके और यूएस, जहाँ पे अच्छा चला है। जर्मनी में आज की स्थिति है कि मुश्किल से मेरे ख्याल से 20% लोग हैं 45 प्लस के जिनको वैक्सीनेशन हुआ है, और जो हमारे एज ग्रुप के लोग हैं वो अभी वैक्सीनेशन के लिए एलिजिबल ही नहीं है यहाँ पर।
बिल्कुल, मेरी कल बात हो रही थी किसी के साथ जो जर्मनी में है, और मैंने उनसे पूछा कि आपकी वैक्सीन कब होगी, तो उन्होंने मुझे बताया कि मे बी एंड ऑफ द ईयर और अर्ली नेक्स्ट ईयर। सो आई सेड आर यू सीरियस? सो ही सेज हाँ, क्योंकि अभी तो वो 90s का खुलेगा, फिर 80s का, तो जब तक हम तक आएंगे, इट विल बी, दैट्स व्हाई वी आर अंडर सच स्ट्रिक्ट लॉकडाउन.
But Advaita, I have to say one thing here. The best thing about India's vaccination program has been vaccinating the frontline workers सबसे पहले. The doctors, the staff, जिनको वाकई जरूरत है. हमारा आप तो फिर भी घर पर बैठे हैं, and you and I should take responsibility for our individual health as well. But people who've been going out, उनका vaccination जितने अच्छे से हुआ है, but वही बात है ना, if we do not want to look at the positives, we will never look at the positives, and we will only highlight whatever is wrong. We will not consider the difference of population, density, anything compared to other countries.
एक पर्सनल अनुभव भी बताना चाहता हूँ अद्वैता जी। मेरे ग्रैंडफादर और फादर दोनों कोविड पॉजिटिव हुए। माय ग्रैंडफादर इज मोर देन 80 years old, my father is around 60, and of course like most Indian men of his age, he suffers from various comorbidities, diabetes, blood pressure, etc. मैं ये बताना चाहूंगा, दोनों को केवल एक एक वैक्सीन शॉट मिला था। माय ग्रैंडफादर इज आल्सो कीमोथेरेपी सर्वाइवर, और दोनों का इलाज बहुत ही आसानी से हो गया। ग्रैंडफादर को थोड़े दिन के लिए हॉस्पिटल जाना पड़ा, पर बहुत ही आसानी से इलाज हो गया। सच तो यह है कि जो ज्यादातर कोविड सर्वाइवर्स हैं उनकी कहानियां यही हैं। तो अगर आप कोविड कॉन्ट्रैक्ट करते हैं तो ओवरवेलमिंग ऑड्स ऐसे हैं कि आपकी यही स्थिति होगी जो मेरे फादर और ग्रैंडफादर की हुई थी। पर हमारी क्या करती है मीडिया, वही दिखाती है कि जिसकी जो है तबीयत बहुत खराब हो जाती है उसको बेड नहीं मिलते। मीडिया को वही दिखाना है, तो मीडिया को भी कहीं ना कहीं रिस्पॉन्सिबिलिटी लेनी पड़ेगी, क्योंकि ये जो ग्लूम और डूम का एटमॉस्फेयर बना दिया गया है पूरे देश में, उससे जो है अर्थव्यवस्था पे और हर चीज पे लोगों की मानसिक स्वास्थ्य पे इतना बुरा असर पड़ रहा है। जबकि ज्यादातर देखिए हम लोग, मैं ये नहीं कह रहा कि रिस्क वही है, गाड़ी चलाने में रिस्क जो है वो कोविड कॉन्ट्रैक्ट करने में रिस्क बराबर है, मैं ये नहीं कह रहा। पर मैं कह रहा हूँ आप गाड़ी चलाते हो, आप अपनी गाड़ी रोड पे चलाते हो, और उसमें कभी ना कभी आपका एक्सीडेंट हो सकता है, लेकिन ज्यादातर आपका एक्सपीरियंस ओवरवेलमिंग यही रहेगा कि आप एक जगह से दूसरी जगह तक पहुंच जाओगे। वैसे ही ज्यादातर सर्वाइवर्स का एक्सपीरियंस होता है कि से ठीक हो जाए।
I mean, and this is not to say that there is not any struggle. There is a lot of struggle right now. There are no beds, oxygen is running short, there are a lot of crisis points, and dealing with it, and we are fighting it, and it's a horrible situation, it's a tragic situation. But this need to intensify the suffering, this need to kind of create this atmosphere is something that frankly is scary. And Abhijit, coming back to the rumor mongering, I'm reminded of something that Osho said when AIDS was the new pandemic in the 80s. And I'm paraphrasing here, but basically someone asked him a question about how to deal with that, because remember in the 80s, the mid 80s, when it first emerged, people didn't know how it was transmitted. They only thought one section of people got it. They only thought animals got it to start with. And then human transmission started, and it was a pandemic, And he said that, the thing is that, maybe 5, 7%, 10% will die from this pandemic. He's saying the remaining 90% who die from this will die because of fear and panic. Yeah. Basically, paraphrasing him. And it's actually true, because people, when they get the positive report, in Kerala, for example, a few days ago, a man committed suicide from a bridge. And because he was COVID positive, when his body was being retrieved, a woman came upon that scene and she jumped off that bridge and committed suicide. And not related to him at all. So, people don't understand that there is so much panic, anxiety, that we have to be a little kind. And that does not mean lie, but that just means don't spread rumors, don't perpetuate a certain negativity, because we have to be strong to get through this.
So, this is something I realized, Advaita, when I was on that ENBA award panel. last month that, most journalists, they don't report or do their job for their viewers or their readers. They don't seek the validation of their readers and their viewers. They seek the validation of their own community, of other journalists. And so what happens is it becomes a pack mentality where the most morbid reporting wins the award. And invariably, you'll find that the award-winning journalists are also the most lowly read or lowly, most hated journalists. Right? There's one TV channel, for example, that has less than 1% viewership that keeps getting all the awards. Why? Because there's a correlation between morbidity, awards, and people not wanting to watch you. Honestly, people absolutely detesting you. I've honestly come to the stage where I believe that while most human beings, in their when they're in their mother's womb, they're surrounded by amniotic fluid. I'm convinced journalists were born in a fluid substance of cobra venom. It's certainly coming out that way these days. There's something to be said for, it is especially, do you remember Churchill's famous words? In war, resolution. In defeat, defiance. And in victory, magnanimity. We are in a war. These people are engaging in defeatism. If you assume we are in defeat, then these people are engaging in the worst kind of defeatism instead of that defiance that you need. I don't think they even consider the mental, they are more concerned about their awards than they are about actual, and this is something that has overtaken the whole of international journalism. Because you remember the award where this started off with the award for that vulture eating that kid in Africa.
Somalia.
In Somalia. And since then, it has now become a disease that infects every single journalist in every single part of the world. There's something fundamental. Yeah, think about it. You have to look after the mental health of the people during times like this.
Yeah.
What kind of irresponsible behavior is this? Now, it's very curious. The same New York Times that's flashing all these images, today they've run a story about how in Australia, a man has been convicted and sentenced to 10 months in prison for recording a video of 4 police officers getting killed in a road accident, and then one more person. And the court sentenced them because they said it was grossly disrespectful. It was violative of their dignity in death and things like that, and they sentenced them to prison. This will never happen in India. Do you remember when a certain famous low TRP, zero TRP, close to zero TRP channel was live reporting a terrorist attack on an Air Force station? The cabinet had decided to blank them out for a day.
Yes.
And the cabinet didn't even have the guts to go through with that. So imagine, even when you have guidelines and laws and when you are found guilty, you're not willing to, there is this sort of VIP culture. How, for certain journalists, how can you do this to them? When a couple in suburban Delhi starts abusing cops and refuses to wear a mask during in their own car, they immediately get arrested and put in jail. When 40,000 protesters are walking without masks and threatening the police, nobody dares put them or their organizers or their leader in jail. The problem is stemming from the fact that A, you don't have guidelines. B, you're too scared to impose those guidelines. C, there is no deterrence value to it. 4, there is no ethical or journalistic, proper ethical training for journalists in this country. Right? Everything. They don't even care if they go bankrupt, as one major award-winning TV channel is, in perpetual bankruptcy, as long as they get their awards and their peer validation. There's something very, very sick and perverted in this profession now. I have honestly, that I keep saying this, Advaita, there is a reason that Bahadur Shah Zafar Marg isn't very far away from GB Road. And one of them is definitely more respectable than the other.
I mean, there has.
Advaita, I just want to add something Abhijit said, and which is so right. The same people who are continuously saying, why did, we knew a second wave was coming, what was being done, are the same people. If you go back to the tweets of last 3-4 months, they were glorifying the protests and, the sealing and occupying of Delhi borders. और तब अगर आप इनको कुछ कह देते तो वो आपको एंटी फार्मर कह दे रहे थे,
So रिचा जी, मैं एक पॉइंट ऐड करना चाहता हूँ once she's done.
Just this. So same people who तब आपको नहीं पता था when you were glorifying all the crowds. वाह, ये देखिए यहाँ गन्ने का रस निकल रहा है और यहाँ ये हो रहा है, वो हो रहा है. Why were you glorifying that crowd there?
मैं इसमें एक चीज और ऐड करना चाहता हूँ. दिल्ली का जो ग्राफ है अगर आप देखें उसमें नवंबर दिसंबर के आसपास आखिरी स्पाइक आई, लास्ट स्पाइक आई थी, तो 6-7 हजार केस रोज आ रहे थे और 100 डेथ हो रही. एंड देन जनवरी फरवरी तक इट वाज डाउन टू 0 डेथ्स, और एक दिन मुझे याद है बीच में ऐसा था केवल 98 या 99 केसेस थे आउट ऑफ ऑलमोस्ट 60,000 डेथ्स. और इस चीज का जो है एविडेंस है, इसको किसी साइंटिफिक एजेंसी ने सर्टिफाई भी किया है कि दिल्ली में अब जो चल रहा है जो वायरस, वो यूके वेरिएंट है. और यूके वेरिएंट की खास बात यही होती है बहुत इजीली ट्रांसमिसिबल होता है, लेकिन फिर इजीली खत्म भी हो जाता है, और थैंकफुली वैक्सीन रेजिस्टेंट अभी तक जो हमें पता है नहीं. तो ये जो यूके वेरिएंट दिल्ली में आया है, ये किसी प्राइम मिनिस्टर की रैली से नहीं आया है, ना कुंभ मेले से आया है. कुंभ मेले में तो लोगों का आरटी-पीसीआर टेस्ट हुआ था, फिर वो लोग गए. ये इस फार्मर्स प्रोटेस्ट की वजह से आया. और जो लोग जो है ऐसा कहते हैं कि फार्मर जो, अब देखिए ये लोग फार्मर्स प्रोटेस्ट पे कितना कॉन्स्पिक्यूअसली साइलेंट है, एक शब्द नहीं निकाल रहे, और प्राइम मिनिस्टर और उसकी रैलीज की बात कर रहे हैं. तो ऐसे लोगों की कोई मॉरल स्पाइन नहीं है, कोई मतलब वो तो जानवरों से भी गए बीते हैं, जिनके इतने दोगलेपन के साथ ये लोग जी कैसे पाते हैं, जिंदा कैसे रहते हैं.
और फिर ये दूसरों को वल्चर कहते हैं. बेस्ट इज कि वो दूसरों को गिद्ध कह रहे हैं आजकल. दैट्स द वर्ड दे डिस्कवर्ड नाउ रिसेंटली.
दैट इज द काइंड ऑफ थिंग दैट दिस.
एक जो इशू जो अभी मुझे लगता है कि देखिए माहौल तो बहुत ही दर्दनाक है, and there is a lot of tragedy around us, and it's a time really to come together and to understand that what we are experiencing. And I have no problem कि आप किसी से भी सवाल करिए, बिल्कुल वो तो अधिकार है, और हम मीडिया की तरफ देखते हैं कि वो लोगों से सवाल करें, स्पेशली दोज जिनके पास सत्ता है. पर आप ऐसे ही सोच रहे हैं कि बस ट्रूथ टू पावर, टॉकिंग ट्रूथ टू पावर इज ओनली टॉकिंग टू मोदी. आप देखिए अलग अलग स्टेट में अलग अलग चीफ मिनिस्टर है, हमारा फेडरल स्ट्रक्चर है, स्टेट चीफ मिनिस्टर है, हेल्थ मिनिस्टर है, ये सबके दायरे में आता है. और उनसे क्यों नहीं सवाल जवाब हो रहा है? बिल्कुल नहीं हो रहा है. अगर आप आंकड़े
नहीं, दिल्ली राजस्थान महाराष्ट्र कोई क्वेश्चनिंग नहीं हो रही है,
बिल्कुल नहीं हो रहा. और राजस्थान कल बहुत ही एक लेडी को बहुत ही इशू हुआ था. मैंने रात के 11 बजे टैग किया एक बड़े नेता को वहां राजस्थान के, उन्होंने जवाब भी दिया. पर ये नहीं है कि ये और जगहों पे नहीं हो रहा, पर जहां आपको लग रहा है कि हाँ इसमें हम पॉलिटिकल रोटियां सेक सकते हैं, उसको आप हाईलाइट कर रहे हैं. ओवरऑल पिक्चर की बात नहीं कर रहे हैं. कंटेनमेंट जोन्स कहाँ होने चाहिए, कैसे होने चाहिए, कैन वी डू अ फेज वाइज कंटेनमेंट, how should we have what policy? पर उसके लिए you have to admit that there is an issue in all parts of the country, not only in one part of the country. When you're starting with the premise that there is only a problem in Yogi's UP and nowhere else, then how are you going to have an effective containment strategy, vaccine rollout strategy? और एक सवाल आया है अभिजीत के लिए. अभिजीत, एक हमारी व्यूअर है, वो आपसे पूछना चाहती है कि व्हाट डू यू थिंक ऑफ द महाराष्ट्र गवर्नमेंट्स डिसीजन टू इंपोर्ट वैक्सीन्स?
It was necessary. Look, everybody has done a lot of things wrong. Center government, state government, everyone. Now, the problem here is that vaccine production was too slow. Okay, and the rate of vaccination was too slow. And this had been highlighted by people. The Financial Times had done a very good story on this way back in January or February. So, if the Maharashtra government is now proactively getting even more vaccines to supplement what they're anyway going to get from the central pool, damn good on the Maharashtra government. Absolutely. Go ahead and do it.
Okay. Okay. Richa, you wanted to come in? Richa ji?
Yeah, about which one? No.
नहीं, on this, I thought you wanted to say something. इसलिए मैं आपसे.
नहीं, मैंने वो.
And the other thing is also कि ये जो data collection है. For example, I started with that there was this whole thing कि आप suppress कर रहे हो data, आप suppress कर रहे हो data. अब आप बताइए इस देश में जब केदारनाथ आपदा आई थी, आई एम फ्रॉम उत्तराखंड, जब उत्तराखंड में आई थी, आप ऑफिशियल आंकड़े देख लीजिए. उस समय सरकार भी अलग थी, सब कुछ अलग था, पर अभी भी लोग कहते हैं कि जितने लोग वहां गायब हुए, जो मर गए थे, वहां पे अभी भी सही आंकड़े बाहर नहीं आए. तो ये जब पैंडेमिक्स आते हैं तो इन काइंड ऑफ चीजों में बहुत ही मुश्किल हो जाती है. और ऐसा एंड सच अ पैंडेमिक वेयर मोस्ट अ लॉट ऑफ पीपल हु आर एसिम्प्टोमेटिक still spread the virus, but they will never feel any symptoms, so they'll never be tested. So it's quite logical that you will not have the actual numbers. It's very difficult to get the actual numbers and things like this. And
मैं ऐड करना चाहता हूँ, मैं ये कहना हूँ, आपने भारत की बात करी, मैं तो ये कहना चाहता हूँ दुनिया के किसी भी देश के आंकड़े इस मामले में रिलायबल नहीं और सब जगह अंडर काउंटिंग हो रही है. छोटा सा एग्जांपल लेंगे न्यूयॉर्क स्टेट का, जिसके गवर्नर एंड्रू कोमो है. न्यूयॉर्क स्टेट में पिछले साल मार्च में रोज 1000 डेथ रिकॉर्ड हो रही है. न्यूयॉर्क की पॉपुलेशन 3 करोड़ के आसपास है पूरे स्टेट की, दिल्ली की 2 करोड़ है. तो अभी जो दिल्ली में जितनी पर कैपिटा डेथ आ रही है उससे ज्यादा न्यूयॉर्क में रिकॉर्ड हो रही थी. और उसमें भी लोगों ने हिसाब लगाया कि वो भी केवल हॉस्पिटल डेथ्स ही काउंट कर रहे हैं. और 25 लोग रोज न्यूयॉर्क में मरा करते थे अपने घरों में, और 250 के आसपास होम डेथ्स जो है रिकॉर्डेड हुई.
और सीनियर सिटीजन होम्स में जो डेथ्स हुई थी, if you Kumo has now had to kind of really take the heat for that, because at the time these were not counted. So this is a historic thing that happens once in every 100 years. And
Advaita, here I would want to add
just one quick thing. And here I want to add that this is once in a while historic occurrence that takes place, and it will change the generations who have lived through this. Trust me, it will change them in the way the world was, in the way the Spanish flu did. COVID will also change us as people. But are we going to change for the better, or are we going to become what we are right now with this rumor mongering? जी रिचा.
आपकी बस बात पे कहना चाहती हूँ कि लग नहीं रहा that we are learning our lessons, but at the same time, I really want to say for governments, be it central, state, whatever, मुझे लगता है डेटा फर्ज करने की या हाइड करने की if it's being done, या डिनाइल में रहने की जरूरत है नहीं. कुछ मिनिस्टर्स अजीब स्टेटमेंट्स दे रहे हैं ना, नहीं कोई कमी नहीं है. प्रॉब्ली I personally feel the better way to handling it, to accept कि हाँ ये shortage है, we are trying to deal with it in so and so manner. When these politicians say ना कोई कमी नहीं है, एंड जब आप ऑन ग्राउंड देख रहे हो कि इतनी प्रॉब्लम हो रही है, लोग इधर से उधर भाग रहे हैं एक अस्पताल से दूसरे अस्पताल, तो वो ना बड़ा अजीब सा लगता है. It doesn't sound right. As people in the authority, as people who are responsible, they should not be giving out such statements. I personally
बिल्कुल सही. नहीं, बिल्कुल सही. मैंने इनफैक्ट कल किया था कि इस समय जैसे कोमो ने जो भी उन्होंने गलती भी की, पर एक चीज जो उन्होंने ठीक अच्छी की कि वो हर दिन न्यूयॉर्क के लोगों से बात करते थे. वो आते थे, कैमरा के सामने बैठते थे और खूब लंबी बात करते थे, कोई रश नहीं, कुछ नहीं, और सब चीजें बताते थे बिल्कुल ऑनेस्टली कि देखिए अभी हमारे पास ये नहीं है तो आप घर पे रहिए, अभी हम नेवी शिप मंगा रहे हैं, उसको हम हॉस्पिटल बना देंगे. याद है आपको अभिजीत? Remembering this, they brought a whole warship and converted into a hospital, and it docked at the port in New York because they had no hospital beds. And you're talking about a country which has possibly, and a city which has possibly the best medical infrastructure, cutting edge in the world.
And mind you, a lot of these stories where later, do you remember during the first wave, there was this story on how Bhopal was running out of burial space for Muslims.
Mhm.
And it
Yes.
turned out that the story was completely fake. They had to wait for the death certificates to come out later. The problem was because Corona, COVID, uh, um, uh, COVID cremations and COVID burials required a much stricter
Protocol.
documentation and things like that. There were
Yes.
backups and delays and so on and so forth happening out there, right? It's not optimal, but the way it was portrayed was particularly bizarre. Now, come to what is happening today. What they'll say is, uh, and this is the BBC, CNN, and co saying this. People estimate the actual death toll may be 10 times higher. Now, you tell me you want me to accept that a government that was so incompetent that it couldn't look after its people is simultaneously so competent that they managed to suppress 90% of the deaths.
And in our kind of funeral practices where we have to cremate,
Exactly.
we,
I
we
mean,
can't bury them.
a cremation is literally, it's like a lighthouse, it's like a torch.
Exactly.
You're
I mean,
literally putting up a signal. You're not even taking it to the forest and burying it. It's there for everybody to see. It has to burn for hours on end for the body to be completely incinerated.
Incinerated, yeah.
And
My point of
it's
Abhijit,
just particularly bizarre. The kind of logical leaps these people want you to take. And when they say it is estimated, experts estimate. Who are all these experts? It's the self-referential echo chamber. They all say, oh, it may be 10 times, it may be 10 times, therefore it suddenly becomes 10 times.
And do they care about what we are experiencing living through this?
I told you this.
Losing people you
I've,
can't
I've yet to meet a single anchor or broadcaster, who actually respects their viewers or their readers. It's all about peer validation from your own group. That is the only thing that matters.
And that then there'll be the congratulatory tweets retweeted that it must be so difficult for you to do this, to report this.
You're a national treasure.
Raghav, you wanted
yeah,
to
I
come in.
just want to add one thing. Since I also spent the last wave in Germany, and what I have realized is that it's not just a phenomenon when it comes to the elite journalists or academicians in these countries. A lot of people in the West were quite envious that India had till now escaped the worst of the pandemic, and scenes similar to what had been observed in the West had, I mean, that kind of horror show had not come to pass in India. So right now there is a sense of barely disguised glee. People are so happy here that finally, look, we had been waiting for you, brown people, to die like flies, and now it's finally happening. That's so great. And then there is this sense of condescension, and you're told, oh, your prime minister did not believe in science. That's why this is happening. Even though all of these countries had great Black Lives Matter protests that were cheered on by these same people.
Because they had an election, so they were.
Exactly. So it's really bad, and that's why I feel that we should not look towards these people for validation when it comes to anything. For them, the only kind of good Indian is a dead Indian. So we should not be looking for validation from them.
But some journalists just love to write for them and go on their video interviews and just say how bad it is in India.
उनको शार्डन फ्रॉड पे उनको बहुत खुशी हो रही है कि यार ये छोटा सा काला लोग फाइनली अब मर रहा है, हम कितने खुश हैं. और हम लोग
there is this attitude that is that I think it's a post-colonial lament or regret, on a very deep level, wherein it kind of encourages you to feel this way, even if you know it's not humane and it's not right. And part of that, I think, has to do with this whole post-colonial lament. In fact, there was somebody from Africa who tweeted a very powerful thing, and it just resonated because she said that, the Western journalists, the New York Times, all of those, that gang, they think Africa doesn't have epidemiologists, doesn't have policy think tanks, doesn't have journalists, doesn't have any of those things. But, our thing is really not about what they think of us, but really what we're doing to ourselves, with this kind of rumor mongering and injecting a political slant to every tragedy. And that is really, really very frightening. And Abhijit, you sound like you want to say something.
I'm numb right now because, I really thought that there would be some kind of human decency in these people. What I've come to realize is they're the absolute scum of the earth. I think this idolization of journalists really needs to stop. I think vultures perform a higher social service than journalists do in this time and age.
And there are questions that are coming in, which I want to now put to you all in the panel. Dr. Chetan is asking, today onwards, Delhi is out of Kejriwal's rule. By the way, Delhi is not India. There are 741 districts, hardly any media reporting from real India. This is a common complaint with...
If you actually look at the spread, the second wave map spread, what you find is it's concentrated in pockets in Delhi, in Kerala, in Bombay, and around Bombay, which is spread. So it's become somewhat biggish around Maharashtra. The rest of the country hasn't seen, and there are pockets in UP and Bengal as well. The rest of the country hasn't seen such big spikes. So if you actually look at the map, I think it's somewhere on my Twitter timeline. You can go check it up. I tweeted it. This was a map as of 2-3 days back. Most of the country was actually fine. It was certain urban centers. There's also a pattern to this, remember. The pattern so far seems to be that the second wave is hitting all the people who skipped the first wave, the better off, who were able to isolate or quarantine better during the first wave. Because a very simple example, where I live, it's the facade of a posh colony that wraps around a village, a so-called village, a Delhi village, which is actually a slum, I guess. And what happens is that particular village was very, very hard hit in the first wave. This wave, there's literally nobody in this entire colony that's gotten COVID. Right? So you're seeing there's certainly some patterns. Now, we can't say this for sure. You have to wait and look at this 3, 4, 5, 6 months down the line when you can start collating the statistics on this. So there's many, many patterns that are here, which we can't really put our finger on immediately because I'm giving a very localized version of what I'm seeing, right? It's prone to, because of the, we're giving you commentary right now as this thing is happening, it's also prone to parallax error and data bias and things like that. So you have to wait for about 3-4 months before we can retrospectively go back and see what exactly happened in this case. But most of the country does not seem to be affected. There are significant urban centers that are being affected.
There's one more question from Chinmay. He wants to know that what's the solution to end such a covert, I don't think it's covert actually, Chinmay, I think it's overt, anti-Modi narrative, which is hurting national interests. Electorally, Modi seems invincible. So how to counter this, how to end this?
Look, it's not really our job, because that job, to counter and to end it and to look after the mental health of Indians as a whole is the government's job. It's a central government's job. The buck stops, as far as I'm concerned, with the central government. You can only hide behind this state list, central list, concurrent list up to a point. After that, you remember that famous plaque on Harry Truman's desk. The buck stops here. Right? The buck stops with the prime minister, full stop. There is no if, but. And, I accept he's in a catch-22 situation. Do and he's damned, they'll find 100 ways to condemn him for it. Don't do and he's damned, and they'll find 100 ways to condemn it. When you're stuck in that situation, why are you worried about this so-called press validation when you have the people's validation? A lot worse things have been said about Modi for the last 20 years. I can't hear you, Advaita.
I said I don't really think he's worried as much as this question is really, and I can understand this because there's this kind of a negativity which is constantly kind of even when there was a good thing like an indigenous vaccine which was working, there was so much negativity spread about it.
And and this is where you need to have a leadership that sits down, and in this, it's very much the government's thing. They should have called a quiet meeting, not an all party meeting. Give them, if you have to massage egos, then massage egos, damn it. You shouldn't feel this was this famous thing that Cardinal Richelieu of France used to say, that self-respect and pride are two things that statesmen cannot afford. And so if it requires me to get down on my knees and beg for France, I will do it.
Right. In fact, VK's brought up another point, which I think is important. कि hospital में भी बिना जरूरत के admission कर रहे हैं just for money. Government need to verify patients who need oxygen and who need to be in home quarantine. Richa?
Yeah.
So can you talk about
this? 3 days back, I was told, in fact, I heard about someone who got admitted, wasn't too unwell, and then suddenly I heard that person has come back home. And then next day I see this report about DM Noida raiding different hospitals in Noida. You won't believe they got 200 beds freed. In this critical time, it was realized that 200 log, so-called kahin VIP contacts, they were using the bed unnecessarily, jinki oxygen levels theek the, out of panic or out of just being wanting to be treated like a VIP. So, glad that Noida DM did this, but is it happening at other places at all? Kya Lucknow mein humko pata chal raha hai kitne logon ne bed unnecessary wo kiya hua hai? Yahan Advaita, I don't know, someone might call me insensitive, but aaj salam hai Nagpur ke wo sajjan ko, who said, I'm 85, I've lived my life, and let the bed be given to a younger one. So I was discussing with a friend, and she said, in Europe, they actually did it. कि जो बहुत elderly है 70, 80, rather than giving them, they paid it. Yeah. So they chose to give all the resources to the younger ones. But हमारे यहाँ इन चीजों को बहुत insensitive बोल दिया जाएगा, so आप इसको publicly नहीं कह सकते. But a lot of people need to understand whether जो resources वो use कर रहे हैं उसकी उनको जरूरत है नहीं. अब ये तो हमें कोई सिखाने बाहर से नहीं आएगा ना. No one else can come and no one can tell me कि तुम black marketing. I mean कैसी कहानियां सुनने को मिल रही है अद्वैता. People black marketing remdesivir, oxygen के पैसे 4 गुना कर दिए हैं. Doctors are getting involved. So moral ethics, so this is our individual responsibility. That needs to be taken care of. Mm-hmm. But I'm so glad Noida DM did those raids and freed 200 beds. This needs to be done all over, wherever.
Raghav, Prateek is asking, he's saying that what about so-called journalists, and he's taken the name of Rana and Kalpana, I don't know exactly who brag around disaster and death of democracy on Channel 4 and DW, crying about their tweets being deleted. हाँ, ये एक और मुद्दा सामने आया, and since all of you are very active on social media, if we can just discuss this for a minute कि ये tweets का क्या कांड है.
जहां तक tweets delete करने का सवाल है तो
and you're a lawyer also, so Raghav, just give us that perspective also.
सरकार का ये कहना है कि वही tweets delete हुए हैं जो misinformation पैनिक फैला रहे. उसमें हमें समझना पड़ेगा कि राणा अयूब जैसे लोगों का क्या रोल है. राणा अयूब को वैसे तो मैं एक चीज बता दूं, मैंने उनसे थोड़ा बहुत मेरा इंटरेक्शन भी रहा है और बहुत ही क्लियर है कि उस महिला का, पता नहीं शायद उनका मुंबई में जब दंगे हुए तो उनका कोई बहुत बुरा अनुभव हुआ था, तो उसको भारत से और हिंदुओं दोनों से चिढ़े और उन्होंने मुझे
let's not
मैं बता रहा हूँ क्यों उनको भिंडरा वाले बहुत बड़ी फैन है. उन्होंने मुझे एक बार बताया था, पर खैर वो बात. तब होता यह है कि जब ऐसी चीजें और ऐसी इमेजेस दिखाई जाती हैं ट्विटर पे, सोशल मीडिया पे, तो लोगों में अपने आप पैनिक बढ़ती है. तो जैसे रेमडेसिविर दवा है या और भी ज्यादा लाइफ सेविंग ड्रग्स है कोविड के टाइम में, उसकी ऑक्सीजन सिलेंडर्स की, इसकी होर्डिंग. तो जब ऐसी सिचुएशन है तो हमें ये ट्राई करना चाहिए कि पैनिक कम हो. पैनिक से हम किसी चीज का इलाज नहीं कर सकते, पैनिक से लोगों में और जो है बुरी बात बता के तो हम उनका इलाज नहीं कर सकते, इससे किसी का फायदा नहीं होगा, इससे नुकसान ही नुकसान हो सकता। तो इसलिए उन ट्वीट्स को सेंसर किया जाना सही था। और ये बात देखिए सही है, राणा अयूब जैसे लोग हों या बहुत सारे जो लोग हैं जो वेस्टर्न मीडिया में आते हैं, मैं थोड़ा बहुत वेस्टर्न मीडिया वालों से इंटरेक्ट करता हूँ, मेरी करंट पार्टनर भी खुद ही जर्मन जर्नलिस्ट हैं, तो मैं अच्छे से जानता हूँ इनका क्या मोडस ऑपरेंडी है। नॉट जस्ट भारत, कोई भी कंट्री ऐसी है जो व्हाइट लोगों की पहले कॉलोनी रही है, उस कंट्री में खराब न्यूज जब आती है और ये लोग देखते हैं, वहां से खराब न्यूज आती है, तानाशाहों के बारे में आती है, ऐसी कोई चीज आती है और लोग मर रहे हैं इसकी खबर आती है, ये लोग देखते हैं, तो इनको एक वैलिडेशन मिलता है, इनको इस बात का वैलिडेशन मिलता है कि कहीं ना कहीं इनको आज भी लगता है कि हम अगर होते वहां पे तो जो है स्थिति बहुत बेहतर होती। तो वेस्टर्न मीडिया का अपना नैरेटिव, और उस नैरेटिव को हेल्प करने के लिए उन्हें भारत में लोग मिलते हैं, राणा अयूब हो गए, चाहे विद्या कृष्णन है, जो जिनका कोई हेल्थ और साइंस में एकेडमिक क्वालिफिकेशन नहीं है, फिर भी हेल्थ और साइंस पे रिपोर्ट करती रहती हैं।
वो
और जो
एक और चीज है, आई थिंक दैट इज वेरी इंपॉर्टेंट कि जो भी हेल्थ और साइंस और ऐसी हाईली स्पेशलाइज्ड एरियाज की रिपोर्टाज करते हैं, उनको दे शुड हैव सम
एग्जैक्टली
एकेडमिक, क्योंकि at times like this you do tend to trust them and read them, and then later on you find out कि अरे इनके बैकग्राउंड में तो ऐसा कुछ है ही नहीं। तो आई थिंक
उनको कुछ नहीं पता है, जिस चीज के बारे में बात करते हैं उन्हें कुछ नहीं है।
So, Abhijit, any last comments? Thank you so much, everybody, for being here. And I just want to take last comments from everybody about, the present situation. And my aim really behind this was, of course, to discuss these issues. And I think a lot of conversation points came into it apart from our primary subject, but also to say that this is a time where the nation needs us to be responsive. They need our responsiveness. They need us also to be responsible. So please be responsive, but do it with responsibility. We all want to help. And I'm not saying that we may make mistakes, because it's a time of urgency and panic and, even desperation. Although I have to say today, at least on my social media, there were fewer requests for the beds and the oxygen.
Yeah,
and
true.
Yeah,
I also
same here.
realized. I
Same here.
felt that. Yeah.
I felt that कि कम आ रही है। मुझे लग रहा है कि थोड़ा तो कुछ तो बदला है और बदला है।
हालांकि एक आखिरी चीज, मेरा लास्ट कमेंट अगर आप लेंगे, अगर आप दिल्ली के आंकड़े उठा के देखें पिछले कुछ दिन से, तो दिल्ली में एक टाइम पे लास्ट वीक और लास्ट वीक के आसपास रोज नेट 1000 बेड्स की ऑक्यूपेंसी बढ़ रही थी। मतलब इवन इफ यू सब्ट्रैक्ट द पीपल हु हैव बीन डिस्चार्ज, 1000 के आसपास वो फिगर था। आज पिछले 3-4 दिन का अगर आप देखें तो जो एवरेज मूविंग एवरेज निकाल रहे हैं तो वो 100 भी नहीं होगा, और बीच में एक दिन ऐसा था कि 400 बेड की ऑक्यूपेंसी कम हुई थी। आज के क्या आंकड़े हैं मुझे नहीं पता, अभी तक पॉइंट। तो मैं और बंबई की आप हालत देखिए कितनी सुधर गई है, जो पीक पे 12,000 केस आ रहे थे अब 4,000 के आसपास रह गए हैं। तो हमारी मीडिया के साथ प्रॉब्लम है कि ये सिर्फ खबर वो नहीं दिखाता, कोई भी ये सारी खबर नहीं दिखाना चाहता, और वो केवल एनेक्डोटल एविडेंस दे दे के आपको जो है आपकी भावनाओं को आंदोलित करते हैं, जिससे आपका दिमाग खराब हो जाए और आप रेमडेसिविर की, ऑक्सीजन सिलेंडर की, इसकी उसकी, और आपको जरूरत भी ना हो हॉस्पिटल जाने की, आप एक हॉस्पिटल बेड पकड़ दो।
वही तो हुआ ना। शाहिद सिद्दीकी जी जो बहुत वरिष्ठ पत्रकार हैं, वो रेमडेसिविर ढूंढ रहे थे किसी के लिए, और उनको फिर उन्होंने ट्वीट किया कि प्रियंका गांधी जी ने उनको दी, क्योंकि वो राहुल गांधी जी के लिए रखा हुआ था, पर उनको जरूरत नहीं पड़ी। तो
राहुल गांधी जी की का स्वास्थ्य मुझसे भी बहुत अच्छा है, और राहुल गांधी जी जैसे व्यक्ति को अगर मुझे लगता है कोई भी सिम्टम नहीं होंगे कोविड जैसी बीमारी के, राहुल गांधी
wanting to stay healthy and well,
उनको नहीं होंगे, लेकिन हम लोगों को मीडिया ने दिमाग में ऐसा डाल दिया कि लोगों को ये लगता है कोविड मतलब आप मौत के मुंह में तो पहुंच ही गए, पर ये इतनी गलत बात है। ज्यादातर जो लोग हैं उनको जो है कोई सिम्टम नहीं होने वाले हैं। मैं अपना एग्जाम्पल देता हूँ, मेरे घर के अंदर 2 लोगों को कोविड था, ठीक है, और मैं उसी घर में रहता रहा, थोड़ा बहुत मैंने डिस्टेंस रखा, मुझे तो वैक्सीनेशन भी नहीं हुआ था, एक दिन भी मुझे मतलब कोई सिम्टम, छोड़िए सिम्टम का कुछ भी नहीं हुआ, और जबकि मैं हर चीज कर रहा था, मैं जिम भी जा रहा था और सारी जितनी मेरी एक्टिविटीज थी मैं करता जा रहा था, और मैंने अपना टेस्टिंग भी कराया, मैंने कोविड कॉन्ट्रैक्ट भी नहीं किया। एक और इसमें बहुत इंपॉर्टेंट स्टडी हुई है, जापान में एक डायमंड प्रिंसेस क्रूज शिप था, तो उसमें कुछ लोगों को कोविड हो गया था, लेकिन पूरे के पूरे क्रूज शिप के सारे ऑक्यूपेंट्स को नहीं हुआ था। तो ये जो सारी पॉजिटिव चीजें हैं कि भाई आपका इम्यून सिस्टम सबसे पावरफुल चीज है, अंत में उस बचाना है तो उसी ने बचाना है और इन ऑल प्रोबेबिलिटी बचा लेगा। ये चीजें हम लोगों को अभी नहीं बता रहे हैं, ये बहुत दुख की बात।
बिल्कुल। और डॉक्टर चेतन ने कहा है, कमेंट आया है उनका कि लेट्स नॉट फोकस सो मच ऑन व्हाट द वेस्टर्न मीडिया सेज। मैं इससे बिल्कुल वाकिफ हूँ। आई थिंक आज फिर से वो बात छिड़ गई, क्योंकि उनसे बहुत नेगेटिविटी हमें मिल रही है। पर और हमें ही नहीं, अफ्रीका को भी यही हो रहा है, जो भी पोस्ट कॉलोनियल नेशन है उनके साथ तो ये हो रहा है। पर उनका एक कमेंट था तो मैंने कहा आपके साथ शेयर कर दूं। ऑल्सो एक और कमेंट आया है जेकब डिसूजा से, जो कह रहे हैं कि ये 3 पैनलिस्ट सबसे बढ़िया रहे हैं, आप इनको ही लाओ टॉपिक्स पे। सो थैंक यू। एंड रिचा जी, आई रियली अप्रिशिएट आपने you know not well but you still participated. And any last comments and then we'll call it a
मैं अभी सिर्फ यही कहूंगी, अद्वैता इनफैक्ट फनी है, कुछ लोग ना ट्विटर पे ये बताने की कोशिश कर रहे हैं कि इफ यू आर टॉकिंग पॉजिटिव तो आप सबसे बड़े बेवकूफ हैं। मैं अभी भी ये कहूंगी कि हम में से जितने लोग कोशिश कर सकते हैं पॉजिटिव, लेट्स स्टे पॉजिटिव, लेट्स ट्राई एंड हेल्प एज मेनी पीपल एज वी कैन। एंड मैंने आज इनफैक्ट एक ट्वीट किया कि उफ, आई नीड टू रिमाइंड माई सेल्फ नॉट टू गेट इनटू नेगेटिव डिस्कशंस। थोड़ा देर के लिए इन्वॉल्व हो गई एक लेडी के साथ, एक आरजे हैं वो, लेकिन मुझे बाद में रियलाइज हुआ, why am I wasting my time on her? She will never understand what I'm trying to say and I won't understand what she wants to say. So इस समय हम लोग बहस में ना पड़े, बहुत ज्यादा डिबेट्स में ना पड़े, काम करें जिसकी मदद, if we can save even one life with our tweet or one contact or whatever, let's just focus on that.
Bilkul. And I think I will hold a discussion on positive news. I think it's very important that we do that also, and not always practice what we preach. And I will do that myself. I will hold one conversation on all the good things. And Abhijit, any last words? And then
no, as Karl Marx would say, last words are meant for fools who haven't said enough during their lifetime. So I've had my say during the last 1 hour, so nothing more to add.
Nothing more. And Adar Poonawala tweeted today that I hereby take a philanthropic decision and reduce the price by 100 rupees.
And isn't that so sad? Because those profits were going to pay off the loan he's taken to expand the
vaccine
production and to accelerate this thing. This is how we treat people in this country. You want it as a matter of right. You're not even willing to pay. Yeah, who doesn't have 600 rupees to pay, boss?
I mean, there are people
who exactly. Coffee pe utna kharch kar denge aap.
I think a lot of us can. Yes.
And the thing is, the only people I have seen tweeting about not having 600 rupees to pay are the ones who would give 600 rupees as a tip to a waiter at a 5-star hotel.
Yeah.
Which reminds me, agar I'm from the hospitality industry, if you're ordering in food, like a lot of people are, please add a tip for your delivery person. It can be 30 rupees, 50 rupees, whatever it is, but please do, because they're working really hard and they're really, they're frontline workers also, and we don't obviously often hear them being spoken of like that. But on that positive note, thank you all 3 of you for joining me. This was really brilliant and a very open discussion, as we like to keep it. And I look forward to being back with you all and the viewers very soon. So thank you once again.